All the products contained in this video are included in our pre- and post-laser skincare kit, available for purchase from My Houston Surgeons. Starting 2 weeks prior to your laser procedure, you should wash the areas of intended treatment with a gentle cleanser, such as Cetaphil, twice daily. Next, if instructed by your clinician, you should pre-treat the skin by applying a small amount of Elastin's Regenerating Skin Nectar. This should be the first product applied on freshly washed skin. Your provider may also instruct you to use a skin brightening agent, such as Elastin's Illuminate or a hydroquinone-containing equivalent for the 2 weeks leading up to the procedure. If you are using hydroquinone, make sure you pause it 2 days before your scheduled treatment. The application of either of these products will follow the above Elastin Skin Nectar and should be performed in both the AM and PM, again during the 2 weeks leading up to your procedure. 1 week prior to your laser, you should stop applying any of your baseline at-home skincare products that may contain glycolic acids or retin A. If you have a history of cold sores or your anticipated treatment area will be around the mouth, you may be prescribed an antiviral or anti-cold sore outbreak medication called Valtrex, also called Valciclovir. You may begin taking this medication 1 day prior to the procedure. Ensure that you continue taking your doses on the day of the procedure, and then continue for 3 days after for a total 5-day course. Please note, if you've been on Accutane within the past 6 months or you're currently pregnant, you're not a candidate for this procedure. If you are a candidate, however, this is what you can expect immediately post-procedure. Dry skin, swelling, and shedding are normal and expected findings immediately after the procedure. Please do not scrub, pick, exfoliate, or wear makeup until the skin has fully shed. This may take 7 to 14 days to occur. To aid with these symptoms, however, feel free to use some of the as-needed products contained within the skincare kit. These products include an ice pack, which can be applied 20 minutes on, 20 minutes off, the SkinCeuticals Biocellulo Mask, which is like a piece of cheesecloth applied directly to your skin for about 10 minutes whenever you feel like the temperature of the treated area is the hottest. This is a one-time use product, then toss. There's also a small bottle of aerosolized Avene thermal spring water. There's no upper limit on this spray. It's just used to help cool the skin as needed. So go right ahead, spray as needed. Every day, including on the evening of your procedure, you should use your fingertips only to wash treated areas with a gentle cleanser such as Cetaphil, and first apply Elastin's Regenerating Skin Nectar, and next, Avene Ciclofate. You will do this twice per day for 14 days or until your skin is back to baseline. In between your AM and PM washing, the skincare applications, you should reapply additional Avene Ciclofate or the white cream to keep the skin super moist, as this helps the skin recover quicker. This may be needed up to hourly during this time. After your evening skincare routine and it's time for bed, it may be helpful to apply the silicone face mask to help keep your products from transferring onto your pillowcase. On days 2 and 3 after the procedure, you'll care for your skin in the same way, except prior to applying any skincare products on your clean, washed face, you'll first blot the skin with a washcloth that's been soaked in equal parts distilled water and white vinegar. Then you'll apply your skincare as previously mentioned. On days 4 to 14 after the procedure, the only new product that you're gonna add is gonna be SkinCeuticals CE Ferulic. You're gonna apply 4 to 5 drops on your freshly washed and dried skin prior to the Skin Nectar and Ciclofate. Now, it's totally normal to have a grid-like appearance on your skin, and then after this sheds, your skin's gonna appear pink like a baby's bottom. It should be treated as carefully as baby's skin also. Maintain strict sun avoidance for at least the 2 weeks while your skin turns over, and if possible, for 1 month total. If you must be outside, you should wear a wide brim sun hat and sunglasses. Sunblock should be added back into your regimen once the skin has fully turned over. Please call our office to inform us if you have painful treated skin, new or worsening brown spots, or redness that does not dissipate but rather worsens. Thank you so much for watching this video. We wish you the best.